Hi, my name is Obina Meniki. I am the CEO and one of the co-founders of Procision, and welcome to our very first podcast. I'm really excited to have my colleague Emily Spooner with me, and she will introduce herself in a little bit. But first, I wanted to share a little bit of background of how we met. When we started the company a little while back, we knew that it was really important that we reached out to people that have and lived the pain of working in a surgery center, lived through the ups and downs, had strong opinions about how to make operations smoother for surgery centers, for staff, for physicians, for nurses, for patients, and wanted to make a difference. So I started reaching out to some folks and happened to come across Emily, and it has been a great partnership ever since. Emily, you've had an incredible journey from ASC admin to consultant to software worker. Can you share a bit more about your career path and what's led you to where you are right now?
Yeah, it has been an incredible journey over the last 22 years and meeting you and Procision along the way in the last 2 years of this journey has been an even more eye-opening experience. But my ASC career started 22 years ago, and I started out working scheduling surgeries in a surgery center. And from then on, moved up really quickly to office manager and surgery center admin, and basically building surgery centers right from my very first ASC. So having to learn every single part of an ASC and how they work, especially as an ASC admin building a new ASC, having that opportunity to know all parts of operations. So, and then in 2020, when COVID happened, I decided to start my own consulting business. And as the all of these things were happening in healthcare, all of these changes, and it was a good move for me. And then 2 years ago, I was able to meet you guys at Precision and really be more behind the scenes when it came to practice management software, EMR software, and those things that are necessary to actually run a surgery center.
Great, thank you. I'm curious, what was on your mind when I first reached out to you, when I told you about the opportunity and asked for your help, and what made you say yes?
You know, you reached out to me at a time that I really started getting going with my consulting and what was working day-to-day operations and really frustrated with the software options that were out there for me. And I felt so limited to what was out there, and I felt like I just had to choose something because there wasn't anything else out there. And at that point, it really became apparent that I could maybe potentially make a difference on creating a better software. As someone that's worked in the space for so long, being able to actually build something by people that use it every day, that was why I said yes. I'm so grateful that I did, and I really feel like I've been able to actually make a difference in the ASC space.
Awesome. Well, we certainly feel that. You've played such a crucial part in the development of precision software, really helping us understand the really what we like to call the voice of the customer, like understand what they need, what their pain points are, and the things that we can do to make their lives a little bit better. Um, how has your experience as an ASE admin shaped the way that you approach this collaboration with us?
Well, I the biggest complaint that I've heard and that I've dealt with in the ASC space when it comes to software is the fact that none of it talks to each other. So besides the limitations in the number of choices that there are to choose of ASC platforms specifically, the fact that these platforms are very disjointed and are just really don't talk to each other. So being able to really see the vision of one platform having everything that you need in an ASC software to manage all of the different things, because there's so many hats in an ASC admin wears. There's so many things that they need to keep track of, and Procision really allows you to do that under one roof, under one dashboard. And that's, as an ASC admin, I think bringing that knowledge in that we do need this connectability, especially new ASCs and small ASCs, independent ASCs, those ASCs that don't have tons and tons of staff that to be able to do all of these different roles, one admin or one nurse manager or sometimes an RN admin. It has to manage all of the business things and all of the clinical things, and being able to have them in one platform is unbelievably helpful.
Yeah, yeah, for sure. Um, from your perspective, what would you say what was it like for you to step into the software world? You know, you obviously spent so much time running surgery centers, helping patients, helping physicians, nurses, kind of like running the sort of front of the scene. What has it been like to step into this behind the scene world? Is there anything that's really surprised you?
When I first started, I just had no idea of the technology that was actually already out there. So just being having that be brought to light for me, the technology that really is out there, that we don't have to be behind the times when it comes to healthcare or ambulatory surgery centers versus banking and these other industries, that there are things out there for healthcare that can improve our world when it comes to software. I think I was just so used to what we had that I didn't know that the technology even existed, without thinking that I'm using this technology in under other industries also. But just the knowledge that you really need to be able to build an ASC software specifically, or an EMR software specifically. I think that there's a lot of people that come together that need to be able to see that. And I think that Procision has done a good job by bringing in billers and surgery schedulers and admins and nurses and anesthesia providers and doctors and all of their voices to be able to create a better platform.
Right. So you mentioned that there's all this technology that you've seen in other areas that you haven't seen all that much of in the healthcare space. What do you think has been some of the biggest roadblocks in getting that technology into such a critical area of our lives to make healthcare workers and facilities more efficient?
I think that overall, the industry hasn't focused on ambulatory surgery centers, even though their growth has been huge in the last 35 years. But the growth in the last 5 years has been just leaps and bounds above that. And so I think now in this space, with the advances of technology in other industries and in general healthcare and clinical space and hospital spaces, and the growth of ASCs, people are recognizing the need for a true like ASC platforms, true ASC driven or designed modules that are specifically for surgery. And I think that the what I saw in these other industries was not brought to the ASC space prior, or even in the healthcare space, in the hospitals or in the clinical space, because we haven't had the need, or they have not forced us to have electronic medical records. So it's kind of held the ASC space back, I think. Not continuing to use paper charts the last 15 years, when when hospitals and clinics were forced to start with an EMR due to reimbursement. I think the ASCs have been cut out of that, but it's also held us back when it comes to technology.
Right. Yeah. So, it's something that I've heard quite a bit, that I know that there are a lot of surgery center executives that are waiting for regulation to dictate that they must have an EMR, and that's what they're waiting for before they pull the trigger. And a lot of that is driven by bad experiences that they've had or their physicians have had with not very great EMRs, either at a surgery center or their clinic. What would you say to an administrator or decision maker at a surgery center who has that perspective that like I'm going to wait until I'm forced to? Like what sort of feedback would you give to them, or advice would you give to them in terms of thinking through this decision to kind of take a step forward in technology?
I would definitely say that it will save you way more money in the long run by having an electronic medical record, especially one that actually communicates with your practice management system, that could potentially communicate with your materials management, which has all of the modules that you need. Having an electronic medical record that goes with that practice management system is going to save you so much more money. You're going to create so many more efficiencies by using an electronic medical record, one specifically customized to your center, to your specialty, versus a paper chart where, especially doing fast cases like GI or eye cases, you know, the paper will slow you down, even though it's really hard to change. I think in the end, all of the nursing staff that we have gone with and trained and over the years taught how to use electronic medical records in the end say yes, it's much more time efficient.
Right. And so you mentioned saving time. And I hear stories about things that surgery center staff administrators would love to find the time to do, but they just can't because they're so bogged down with paper charts or inefficient electronic charts. From your perspective, if we were to free up some of this time, what would you suggest the surgery center kind of refocus some of that time and effort to? What would be the most value added use of that extra time?
Honestly, I think what is lacking in ambulatory surgery centers due to the lack of time and the fact that everyone is so busy is really employee and physician appreciation and engagement. Being able to give back to your employees and spend time to actually get to know them and their concerns are it's a huge complaint that I hear that from staff that they don't feel heard. So I really feel like getting back into that, not only employee culture, physician culture, being able to recruit more physicians, spend more time on that, but also patient engagement. One of those things that we are now reimbursed on is based on that patient engagement and those patient satisfaction surveys. So that's where we need to probably be spending more of our time versus huge inefficiencies by scanning in paper charts and having to bill off of paper charts and chart paper charts.
Okay. Right. I would say one of the things that's been very rewarding for me, and I know for you as well, has been the number of healthcare professionals and surgery center professionals that I've had the honor of interacting with, learning from, helping, um, and just a group of incredibly talented people, incredibly passionate people, and like entrepreneurial, like us, like because they're often trying to do a lot with a little. I'm just curious if there's, and I know that you've gotten to meet a lot of surgery center professionals, both through Procision as well as through your consulting business. I'm wondering if there's any moments that stand out, like any particular client experience that you've had that really resonates with you that you would like to share.
Um, I over the last 2 years, I would say last year we at Precision went live with a client in Nebraska, and it was um, a really memorable experience in the sense that their lives changed and being able to see the change from the inefficiencies. Although they did use electronic medical records previously, it was a complete 180 with Procision for them due to the number of steps and all of those things. And it really helped create so many more efficiencies in their practice, in their surgery center, and just overall because they were able to go to like 99.9% paper or paperless and not have to have multiple inefficiencies that they were going through previously. It was it We've continued to maintain a great relationship with them and see the things that they are still incredibly happy with, and see the physicians really who probably push back more than anybody on switching electronic medical records really be completely happy with the product. And to hear from the administrator, the physicians never complain about having to use the EMR anymore, when before it was a constant complaint for them. So yeah, that would probably be like the best experience, the most memorable experience so far.
That's awesome. Um, Great. Those that we work with in this space, as you know, as you are, and as we all are incredibly passionate and dedicated people. You've been in a sort of operating role at surgery centers, as you mentioned, for the last 22 years, and for the first time over the last couple of years, you're not. I'm curious if you have any newfound appreciation for that role, kind of being on the other side and having stepped away from it for a few years, or any thoughts along those lines that you would like to share.
Yeah, I think that I did it for so long, and so I just did it without thinking. All of the things, all of the hats, all of the physical plant things, all of the patient things, all of the staffing things. You just do them over and over and over for so many years that you don't even realize how much it is. And I think until you really step away, do you realize, oh my gosh, how much work that is to be an admin. I feel more for admins now than I've ever felt for myself. and and I think sometimes you do see that new appreciation once you step out of that role. But also, an appreciation for a new type of role that I've been able to undertake, and learn a whole new industry, which is the tech industry, and specifically healthcare tech. It's been an amazing experience so far.
Okay. I know we've talked quite a bit about the new skills that you've learned being on the tech side. Was wondering if you would like to share something exciting that you've learned or that you've been doing while working at Precision,
Yeah.
a skill that maybe you have now that you did not think that you would develop just a couple years ago.
Yeah, even when I started full time with Precision, I had no idea that I was going to learn how to do all of the things that really are required when building an electronic medical record. So being able to be behind the scenes, be on the back end, and actually create those electronic medical records and those charts so much more specifically for these centers and for their specialties. Being able to create a vascular chart, being able to create an ortho chart, being able to bring the knowledge that I have as working in the ASC space and read those charts and be able to convert them into electronic charts has been so rewarding. I had no idea how rewarding it would be to be able to actually build these charts, but to do this for centers so they don't also have to do it themselves, because in my opinion, it should be someone with this background. And it took me so many months to be able to just do that. But it shouldn't fall on the staff of the surgery center employees, and I am happy to do it for all of those surgery centers. So that's not something I ever thought I would ever do, and and it's been so awesome to be able to do that.
Awesome. Yeah. Um, something that I've, a number of administrators have told me was that they sort of had to moonlight as IT for several months as they built and configured their own charts. Um, I think that as we think about ways in which you talk about how busy, how many hats people that work at surgery centers have to wear, think about ways in which we can help surgery center staff and help make them more efficient. Like what are some of the things that we as a software company can do?
I think definitely taking over that role and really taking charge of the implementation from the beginning. And that is something that we do at Procision. We take charge of the implementation and keep track of what information we need as Procision to be able to build the platform specifically for that center. But really taking charge of that implementation, staying on top of it, and making sure that we help out the centers as much as we possibly can. And something else that we do is provide these templates that we've already created for different specialties, so they can modify them from there instead of having to reinvent the wheel. but also the fact that we build those charts for them and we do the changes that they need. If they decide that they don't want to ask that question, we can remove those questions. And if they decide they aren't going to do post-operative calls and then want to do post-operative calls, that we're very flexible. And I think that that is our something that we definitely pride ourselves in, being able to do the behind the scenes for the surgery centers and provide them as much support as possible for as long as they need.
Yeah, awesome. Emily, this has been such a great conversation. Before we wrap up, um, I wanted to mention that this is our first podcast. I'm curious if there's anything else that you would love to hear as a topic in future podcasts as we continue to do this more frequently.
As an ASC admin, I really think that we should share more about these updates in technology, these advances in technology, the opportunities that we have to further technology in this healthcare space and help the ASC world. And we're just touching the tip of the iceberg. There's just so much more technology advances out there available, and I definitely think that we should share that next podcast.
Okay, cool. I think we will. And then final thought is, if for folks that are interested in learning a little bit more about you and your journey, where can they go to find that?
My LinkedIn, just Emily Spooner on LinkedIn. You should be able to find me, or Marissa Consulting, marissaconsulting.com. And you'll definitely find me at emily@procision.com.
All right, awesome. Well, thank you so much, Emily. It's a pleasure as always, and we'll see you at the next chat.
See you soon.